Can you talk to us about the importance of PSP having access to healthcare?
Certainly. In our qualitative studies with public safety personnel, one of the things that we really heard from them very loud and clear was that they had difficulty accessing care. And there were a lot of issues around that. For some, actually, access to care was fairly good. So I think of cities like Calgary and Hamilton that have comprehensive programs in place for their firefighters. They have an annual medical screen, they have staff who are familiar working with public safety personnel that can provide services. But along that spectrum, it goes down to some people who have really very poor care. People who come from communities where there are no services for them in their fire service. They might not have a physiotherapist for their musculoskeletal injuries. They can't see a psychologist for their mental health, and they might not even have a family doctor. And in some provinces, people have been waiting multiple years on a wait list to get a family doctor. So you contrast that very big disparity between what's haves and have-nots, and it was a big contextual factor for the public safety personnel in terms of access to care. There were other systemic issues. So for services like psychology and physiotherapy, there are often things that are in the private sector, not in the public sector. So if they go to their family physician, that's covered. If you go to see a surgeon, that's covered. But if you need psychological counseling or if you need to see a physiotherapist, that might have to be private services. And many plans, even if you do have them, have a limit of $500, and that might be for your psychology and your physiotherapy for a whole year. And clearly that's inadequate. So we had people say, I can't get any more care because I've used up my $500. The other big theme we heard from people is that many of the healthcare providers they went to didn't really understand the kind of work that they had to return to, and so they weren't really understanding the care. And so we'd see people who had gone to multiple therapists before they found one that actually really understood their work. So those were two big things, finding somebody and then finding somebody who understood what they needed to return to.